Hi, my name is Angela Wayte. I am a public health specialist for Lewis County Public Health, and we're here today with
Shereen Palmer, Dr. Shereen Palmer. I'm a pediatrician, and I work at Lowville Medical Associates. I also am currently the medical director at Public Health.
We are going live today to discuss COVID-19 vaccinations, primarily in the children and youth population. If you caught our live stream last week with Dr. Leindecker, he focused a bit more on the adult side of COVID-19 vaccines. But now as we transition a bit more to the youth and children side of things, we thought it would be great to do this all over again, but with someone who is more focused in pediatrics. So that's what we're going to be doing today. So we're going to get right into it. These questions are questions that I know we receive quite often at Lewis County Public Health, and I'm sure you receive quite often as well. If you have questions while we are discussing, that will come at the end of the pre-written questions that I have, so feel free to leave a question, and when we're done with our questions here, we will answer those as well. So we'll get right into it. Which of the COVID-19 vaccines is currently approved for youth? Because they're not all at this time.
That's correct. So right now we have in the United States 3 vaccines that are available for COVID-19 protection. Only one of them, which is the Pfizer BioNTech vaccine, is the one that's currently available for use in children 12 and up. The mRNA vaccine that is under study, Moderna, they're looking at trying to make it available as well, but right now it's just the Pfizer, and then the Johnson & Johnson one, which is a different structured vaccine. That one is not, I don't think, being looked at as significantly for children.
Thank you. Another question we get pretty often is, so is Pfizer in particular, would that be safe for children?
Yeah. So my answer is yes. As a parent, my answer is yes, and all of my children have had the vaccine, including my 15-year-old son. And as a pediatrician, my answer is yes. I have a lot of patients asking about that for sure right now. The vaccine at this point has been given out, well over several hundred million doses in the United States alone. And what the advantage of that is it teaches us what any significant but rare side effects might be. For a long time, we weren't seeing anything whatsoever, other than mild side effects of having maybe some achiness, some headache, maybe some fever. The main significant thing would be the arm soreness. So of the patients that I've had have gotten the vaccine, very mild symptoms that are self-limited. More recently there's been press because so many doses have been given out that they are noticing that there is a concern about possible inflammation of the heart muscle. And I can talk more about that right now if that's okay.
Sure.
Because that's the thing that I think we're spending the most time talking about. So the viruses traditionally have rarely affected kids, potentially either the pericardium, which is the membrane around the heart, or the heart muscle itself. It's something that we see in our careers a few times. I've had a couple of patients in my entire career, 57, with myocarditis related to other viruses. So it's something we have seen in the past. Most times it's because of the body's immune system gets revved up and starts to respond to the virus, and then it will go after the heart muscle, kind of like a friendly fire situation, where instead of attacking the virus, it attacks normal body tissue. So it has been something we've seen. What's been interesting is with COVID infection, natural disease infection, we started seeing a lot more of myocarditis. It's part of the syndrome, that multi-inflammatory systemic syndrome that we were seeing in kids, where they would have multiple systems involved, the heart being a very common one, as well as GI tract and kidneys, skin, sometimes brain. So it's a known complication with COVID, because with kids, sometimes they don't have as much an initial phase like adults have, where they have a lot of respiratory symptoms. With kids, they may have some mild respiratory symptoms, they may have some GI symptoms, but occasionally, but rarely, those are the most severe. The thing we have come to fear a little bit more is what happens 1 to 2 weeks after the primary infection, because kids can kick into this very concerning multi-inflammatory system disease. And there are kids in this state in our ICUs that have heart muscle inflammation that are on multiple medications that are very sick. Fortunately, because kids are resilient, they tend to recover. But it is something that we take very, very seriously, and we have seen. So, not surprisingly, I guess, the vaccines, which are stimulating the body's immune system, we are seeing a little bit of inflammation of the heart muscle because of the fact that it is so good at successfully stimulating the immune system. The thing that my son's first vaccine, he's 15, male, which tends to be the population, the adolescent, young adult population that we see a little more. So he got his first dose before we knew about this, and then the second dose, we had heard about this, and I read about it. And the thing that I would say, I do say to my patients and to people who are concerned about it, is if having this mRNA vaccine gives him a little bit of the spike protein for a controlled release in a small amount for a short period of time, if that stimulates enough of his immune system to cause heart inflammation, imagine if he had gotten natural infection. So imagine if he had gotten replicating virus in his system for 5 days, 6 days, 7 days in large amounts. I would be much more concerned about the degree of heart inflammation he would have in that situation. So what we're seeing with kids who have mild inflammation after the vaccine is it's very self-limited, it resolves. They're being admitted right now to the hospital for monitoring, for some of them just, ibuprofen or some kind of a non-steroidal anti-inflammatory. They go home in a few days, it fully resolves. They'll continue to be tracked, of course. But it's not happening often. It's exceedingly rare. I read one number. I was trying to find the number of kids who've had the mRNA vaccine, and I found one place where they recorded 7 million, but I wasn't able to find that in other stats. So, but let's say we have, millions of, this age group, this 12 to 30, which is kind of the age group I think that people have focused a little bit more on with this heart inflammation, who have got millions who've gotten that vaccine and completed the series, and we have like 1,196 people who have had the inflammation, and a subset of those are children, and the children are fully resolving. We're talking about much, much, much less than 1% much less than 1%, probably less than 0.1% of a complication rate. Now, take COVID, where it's something we are seeing on a regular basis, and I think if you polled, our hospitals in the area, you would find that they have definitely had more kids with myocarditis than they have ever seen in their careers at one time in their ICUs. So I think for me, it's clear, and it was clear when I make the decision for my son, that the benefit to avoid a much more severe presentation, it was clear to me that the vaccine was worth it, and he got a second dose and did great. Actually, chatted all the way home while he ate his milkshake, and but so I would really urge people to. It's important to continue to follow it. It is being followed. It is being taken seriously. We are all on notice. When they went public with that, it wasn't just to make parents aware. It was to make pediatricians aware that you need to be looking for this. So symptoms like chest pain or difficulty breathing or a sense of palpitations. The week after vaccination, first or second dose, if you see those, think hard, get on it, contact your pediatric cardiologist. So they're asking us to be vigilant. We are all being vigilant. The pediatric cardiologists in Syracuse are awesome. If we have any concerns, they call it, we have them on speed dial, with questions, and we send them EKG sometimes, and they review things right away. It is not something that's being buried under the rug. It's being, the whole point of monitoring vaccines is so that you can, when this situation arises, you can pick up on it, monitor for it, eyes wide open. I think, one of the reasons that the FDA has this week asked the drug companies to open up the numbers that they're using in their studies to enroll is to look specifically at this issue. So I guess I want to reassure parents that we are all parents too, and we don't want to recommend anything for your child that we wouldn't recommend for our own. And that, it's not just us, it's people, it's part of the FDA and the CDC and stuff. So I would say, yes, it is safe. Yes, it's being looked at. You know, the other point I make to people, I'm sorry, I'm going on. I'm passionate
I
about
love it. Go for it.
The other thing I want to point out to folks is, so I think in the beginning when this all was happening and the vaccine became available to children, what I was saying to parents is that, you know, you've got kind of three pools. You've got like you can choose to be vaccinated and be protected. You can choose to get the disease, and most kids are going to do fine with it, no question. But there are going to be some who are going to have this multi-system inflammatory. There's going to be some who are going to have some long COVID kind of symptoms. We've seen some of that where there's some emotional or fatigue symptoms that are, you know, probably related as we look more forward into it. And then you can be in the group that doesn't get either one. So you can be in the group that doesn't get the vaccine, doesn't get natural disease, and stays isolated, because that's what you have to continue to do to not get the disease. The reason why it's called a novel coronavirus is because none of us have ever had it before. And so the bottom line is, you're at some point when you're exposed to it, you're probably going to get it. And the same is true for your child. So before Delta, maybe, I guess what I was kind of hoping is, because I knew not everyone was necessarily going to go for the vaccine, especially in the beginning. So I was kind of hoping that if we got our rates up high enough, that we would have a low enough incidence that we didn't have to worry about people, you know, having, you know, another huge outbreak. But unfortunately, Delta is now here in the United States and in New York State. And so what is going to happen, this virus, before it was kind of like regular COVID was already more contagious than flu, this is like COVID plus. So now this is twice as contagious as regular COVID. And also your body replicates more of it. So there was a study that came out of China that was tracking what the viral load was. And this one, you replicate much quicker. So that makes it more likely to be shed. So instead of me, if I'm a COVID person who's not feeling so bad, not knocked off my feet, just has a little runny nose, you know, I might drop something off at my neighbor's house or my family member's house, not realizing I'm carrying it. But now, instead of like 2 times more likely, you know, instead of giving it to 2 people, I'm likely to give it to more like, you know, 3.8 or 4 people. So, and then that adds up. So if I give it to 4 people and those 4 people give it to 4 people, quickly you have this, you know, asymptotic spread. So I think this third category of where I'm going to stay isolated is becoming less and less of an option. And honestly, no one wants to continue to be isolated, and certainly not your children. I think every parent will attest that school is a good thing, 5 days a week is a good thing, and sports is a good thing, and having social events is a good thing, and youth groups are a good thing, and family reunions are a good thing. So we want our kids to have those social exposures as part of normal growth and development. So this third pool, while it was effective before we had vaccine to at least keep our total, you know, incidence of morbidity and mortality down, it was helpful. It's nowhere any of us want to stay. And the reality is society is not going to stay there. Society is opening back up. So sadly, you are, as a parent, you know, being forced more into this position of making a decision in which group you want your kids to be in. One of the things that we were talking about earlier was, okay, so if you have a child who's not 12 and up,
Right.
because now those studies, we don't know what the time course is going to be. You know, we're hoping that by November-ish, we'll be able to have, be able to open that vaccine up to a larger age category. But they're going to be asking for more study participants, so we'll see if it's going to be November or not. But so we have this period of time here where the younger kids are going to be out in the world and they're not going to necessarily be protected. And the thing that I say to my parents to try to reassure them for those kids is school did a very excellent job, you know, with transmissions. We had very minimal, if any, transmissions within the schools. And the only thing I can say is masks work. You know, I think many pediatricians will tell you that we saw so much less flu and other diseases than ever. You know, I think, and school nurses will tell you masks work. There was a lot less transmission. So I think school is not the place where your kids are likely to pick this up if they're unvaccinated. What we found, and I'm sure you would attest in public health, is that what we found is transmission happened from your neighbors and your family members and your co-workers. And so you're more likely, if you're unvaccinated, to bring it home to your kids than they are to pick it up at school. So if you want to protect your children who are too young for vaccination, the key is get vaccinated. And the ones in your family that are old enough to get it, I would urge you to strongly consider doing it. I did. And try to encourage the people around you to get vaccinated. I mean, the reason Delta is here is because the virus was allowed to continue to move from person to person to person and got smarter and evolved with time and became, a little bit more of, like I said, COVID plus.
Yeah.
That's not really a term, but Delta is kind of, COVID plus. And if we could stop transmission and get this thing to not continue to replicate in a natural host, which is us, it would be very, very helpful to protect the next generation and the next generation of kids. So I'm urging people to strongly consider getting your child vaccinated, strongly consider getting yourself vaccinated if you're not already, and encourage people who are in your children's lives to also get it. Because now, we are at, I wrote it down, it was like 342 million doses and counting have been given a vaccine. So for us as pediatricians, when a new vaccine comes out, we usually wait a little period of time because, the initial release is often about 70,000 doses given. So I'm like, okay, I want to wait 6 months so I can make sure I know what those 1 in a million side effect dose, are for my patients before I offer the vaccine to them. So we're way past the 1 in a million side effect. We're at like if we're just talking pediatrics, 1 in 7 million side effect. But for the general population, and the world is much more than that. So we've never had such good information, honestly, on any other vaccines that I have offered my patients. I've never had this good of information as I do right now.
Yeah, and you're transitioning actually into a question that is next. So one concern that...
Please feel free to talk, because
no worries. I'm just the facilitator. So the parents have many concerns.
Sure.
One of which, not only for maybe their children, but for themselves, might be they feel that the vaccine was created quickly, which I think is kind of where you were getting to there, is we have so much more information with this vaccine than we have with any other one. So can you kind of speak to that?
Yeah. Okay, so let's break it down. So in order to have a vaccine shown to be safe and effective, there's these 3 trials that they take it through to kind of, look to see initially, does it seem to work? And then, which is kind of phase 1. Phase 2, are there any major safety issues that need to make this a hard stop now? And then phase 3, where they roll it out more broadly and then look for those more subtle, smaller kind of safety issues as they may or may not present themselves. So the phase 3 trial is something that usually takes a fair amount of time. Because you have to enroll enough people into the study, because there's a certain amount you're required to have. But B, you have to have enough documented disease to be able to demonstrate an effect. So for instance, if I was going to do a new pertussis vaccine, that would be very difficult to test, because with the current vaccination that we have, our incidence of pertussis is significantly down. You could probably tell me better, but in our community, we maybe have like 10 a year, maybe not even that much certain winters. So you'd have to have enough disease to document that, yes, this is protective, because here's the population that got the vaccine, here's the population that didn't, and this is the difference in disease. So if you're talking about pertussis, say, oh, this population got 10, this population got none, but are they statistically different? So you have to have enough disease to be able to demonstrate effect. So in a pandemic, when no one has immunity, you end up having an explosion quickly, and that's what happened here, in part because COVID didn't knock so many people off their feet.
Right.
The reason why MERS and SARS-1 those virus outbreaks died down is because it knocked people off their feet so quickly. Here, many people are asymptomatic and continue to walk around and spread it. So, so going back to it. So I think in this case we had this explosion of disease, so it became fairly easy to document statistically significant effects, that this was actually efficacious because all these people got it,
right,
and none of these people did. And that's how you got to that like 94, 95%, depending on the vaccine, effective rate. So, and people, because it was exploding and we were seeing so much of it, people were anxious to sign up. So, you'd put an ad out and say, hey, Rochester Strong Hospital is doing a trial for Moderna. If you're interested, let us know. And they would get an overwhelming response. So you had a lot of people willing to participate, and you had a lot of disease that you could show whether or not it was effective fairly quickly. So those two things were absolutely key. And I don't know if you remember, but in the beginning when they were saying we're not going to get a vaccine for 2 years, and the researchers were saying we're just hoping there's enough disease that we're not isolating so much that there'll be enough disease to be able to tell whether or not it works. So that was not an issue in the US. We had enough disease that we were able to tell. The other thing, which I think Steve mentioned last week, that I mentioned SARS-1 and MERS, there were other COVID viruses that had come around prior that there had been research on a vaccine done. So we were able to piggyback off of that, we being, industry in the US, they were able to piggyback off of that work and identify, hey, this was effective, but we never had enough people to actually do the studies, but let's use this technology. And the technology is much more advanced than it would have been 5 years ago, 10 years ago, 20 years ago. They had this thing sequenced very quickly. They were able to figure out what is the mRNA, which basically just creates this little protein fragment. What is the mRNA combination that we need in order to have our body, some of our cells be able to pick up that recipe and create this protein fragment that irritates the body's immune system enough to create a response. So we had the technology that we quickly got it sequenced, we were able to develop that fragment. We had the previous roadmap on how to make one of these vaccines. We had enough people willing to do it, and we had enough disease. And then, so that was one thing, all those things together really compressed. And then on top of that, you had a government that was willing to pay for it before we ever even knew if it worked. So, the government invested in us because they knew it was a global threat and a threat to, everyone's health and safety, that they paid. Some of the companies didn't, some of them did it on their own. But others, received money, and what they did is they invested and produced the vaccine, got the vials, got the labels, got everything ready so that as soon as we knew it was ready to roll, if it was ready to roll, and that's a big if because not all the vaccines are out. Some of them have made it to production and some of them haven't. But so if it was safe and effective and they got the green light, then they would be able to immediately release it. The FDA approval process is the final thing. Normally, you have to wait in line. You wait your turn. No one company has more sway than another, but when the U.S. government says this goes to the front of the line every time, every product, so it gets a thorough review quickly, so all of those things together, got what we thought was medically impossible to happen. I've told my daughters this, that because a couple of them are interested in medicine, that right now they're living through what will be remembered as a medical miracle. There's these different historical periods where, the eradication of smallpox and then polio, and there's these different times where science really steps up, and we get lucky, and really steps up and makes a huge fundamental change in the health and well-being of children. In general, polio especially. But this is one of those times in history that, where we really are blessed to be seeing a medical miracle.
Now you mentioned, yeah, I think so. I think that was a great explanation. You mentioned in that answer that some of the vaccines we have right now are 94 or 95% effective. Is that effectiveness, does it translate to children and youth as well?
Yes, absolutely. Kids were performing in the 90s for I can't remember. So the Moderna stuff is not out yet. So, but for the Pfizer, yeah, we're definitely up in the 93, depending on what you read, 96, in the age group and stuff. But yeah, highly effective. And again, that's a gift. Viral vaccines can be hard to produce. We have one called the MMR, which a lot of kids have had. If they go to school, they've all had it. That we used to consider the gold standard because that was like a 90% effective vaccine. We got something, just as good as that. So yeah, it would be just as efficacious in kids. And I think, the thought would be with the younger ages, what happens with a lower dose? Can you get those same rates of efficaciousness? And that's what they're looking at.
Now, you mentioned a buzzword that we've been hearing a lot, which is school. So as of today, do we know, will a COVID-19 vaccine be required for youth to receive before they can attend school in the fall?
Not as far as we know, no.
Okay.
That is not the plan at this point.
Perfect. If my child has already had COVID, should they still be vaccinated?
That's a good question.
It's a great question.
Well,
or are there benefits to being vaccinated?
There are. I think one of the things we don't know right now, because we're still, just a year into it, how long your natural immunity will hold. So, after someone has infection, they have immunity, and right now it's kind of being recognized for the CDC for 3 months. It's, there are studies out there showing, longer than that, 7 months, 8 months. We don't know how long it holds, and also it wanes. There's two types of immunity that come, one is antibody and one is a cell mediated, which is more like a T cell. It's a different part of the immune system. So both of those are triggered by the natural virus as well as by the vaccine. But the cell mediated immunity is a little bit harder to measure. So antibody-wise, it does seem to be holding for a period of time, but not in everybody. So the concern is over time, the antibody immunity will be waning, and someone will become susceptible. So I think for sure right now, the recommendation is that you go ahead and complete the entire series. May there come a time, I don't know if I should say this,
right? May
there come a time where someone may just get one dose after a natural infection and it serves as a booster. It may, but I have a family member who had COVID, and she got both doses of the vaccine and did very well with them. I think the second one she laid around for a few hours or whatever, but I do feel like for sure, because of the fact that there are some people getting, a second round of COVID, and there is waning immunity, it's a good idea to go ahead and vaccinate. I think Delta, again, I referred to this, that the idea that it replicates very, very well. I think that you guys probably know and have heard that there are some people who are vaccinated who are also breaking through with Delta and testing positive. Very mild disease, not being hospitalized, doing well with it. So, but because of that, I think it's possible everyone's going to need to be boosted. People with natural infection and people who have gotten the primary series. So, it's one of those, yes, I would get vaccinated maybe had disease. One of the advantages we haven't even talked about, so, for kids, for teenagers, the idea of not having to worry about getting sick is a huge reassurance for their family and for them. Not worry about making other people sick is also an important benefit, especially for them. And I see that with my teenage patients when I say they don't have to worry about making you sick if they're vaccinated. They're like, yes, they just don't want to have to worry about having someone that they care about get sick because of them. But the other big benefit is quarantine. If you get the vaccination, then you don't have to worry about being quarantined as long as you're asymptomatic. So, if you've had an exposure and you're asymptomatic and you've had the vaccine, you can still go to your soccer game, you can still go to things, you don't have to have a quarantine. So, I think that's a kind of a social benefit. And I do think the reassurance of knowing that I'm not concerned anymore that my child might have something that lands them in the hospital, because this vaccine will protect them against that.
I'm really glad that you brought the mental piece of it up, like that mental reassurance that,
yes,
because I think when you hear about benefits of a vaccine, you immediately go, protecting yourself and others, but that mental reassurance, that relief of like I'm doing what I can do in order to prevent myself from unintentionally giving the virus to someone else, I think is huge,
Right.
especially with our youth.
Right.
You know, they internalize a lot of that.
And I think parents should talk to their kids about that. I think that is probably there more than we realize. That I think they worry about us, and they worry about their grandparents and aunts and uncles and someone, the vaccine is highly effective. However, if someone's immunocompromised, it may not be quite as good. So if I have an aunt who's got cancer, or I have a grandparent who's, has a history of cancer or is on immunosuppressant med, the vaccine is excellent, but maybe not as effective. And so for the whole family to get protected and protect them is a good thing. So.
Yeah. Another question we get quite often, and we touched on this a little bit towards the beginning, is if children do fairly well with COVID-19, some people believe that it might just be worth risking it and not, and like I said, you touched on this earlier. So why would you recommend, even if children are doing fairly well with COVID, that they still be vaccinated when the vaccine is available to them?
Yeah. So, okay, so I when I was looking up kind of my numbers for today, so there's been about 4,000 cases of nationally of this multi-inflammatory system disease. So I think that is something that, obviously as a pediatrician, I hope none of my patients ever get. Those kids are very sick, and sometimes there'll be some sequela that will continuing to follow. I've only had, I've had one patient I had to admit with a pneumonia, and they had a comorbid condition, but that was a scary time for the family. And then, of course, nationally, there have been some deaths in pediatrics. There was, I think, 349 is the most recent count that I saw. So, I mean, that's very rare, obviously, but who of us, I don't want to say that, but who of us wants to be, one of those families? So I guess there's a peace of mind that comes to knowing that your child is protected. And I do think, those are the most serious of how I'm talking about, but I do think the long COVID is something of significance. I wish there was more data out about that. It's something that we all kind of talk to each other about. Mental health is overwhelmed, and I know that people feel like that's because of the isolation that kids were under, and I think that is true, that sometimes seeing that teacher every day, that's kind of that person that you just totally get and they get you, that was a loss for kids. But I do think the mental health strain of worrying about everyone around you and your own health, and then also if you've had COVID in the past, the level when your fatigue is there and stuff. So I think there are things to not be discounted about getting the disease. Obviously, I felt that way because I chose to get it for my kids. Now, obviously, I see, and my partner, Mary Lou, Dr. Philmeyer, Dr. Piznell, who sees kids in the hospital, Dr. McHugh, the ones of us who see kids, we're going to see the worst of the things, so we may have a jaded perspective, but yet I think if you survey, 95% of physicians all have the vaccine and get their families vaccinated. So there's a reason for that. None of us want people that we love to get it, including our patients.
Correct. Another thing I see quite often, so I clearly am involved with the Lewis County Public Health Facebook page and do all that kind of stuff. So as I peruse around to kind of see what people are talking about, a common concern is, well, I don't know if it will affect their fertility later on in life, or puberty or anything like that. So what insight could you give to that? Yeah.
Yes. So I think that, how many months has that been around? 5 months? 4 or 5 months? So, so the best that we can tell, I kind of tried to track and find out where that originally came from. I found a good podcast by an OBGYN who had done some research into it a little bit too. So as far as we can tell, that got started on the internet by a non-science-based group that put a memo of concern out to like a regulatory body in Europe when the vaccines were being investigated. And it got on the internet and kind of took on a life of its own. It got picked up by groups in the United States who were concerned. And it's just kind of taken on a life of its own. So I want to be clear to say that there's never been any science to document that this is a valid concern. The opposite is true, that they have been tracking, with Pfizer, they were tracking their groups when they originally were doing the studies. The rate of pregnancy was actually higher in the vaccine group than in the placebo group, way back in the original studies last fall. Studies have come out now, it's been being tracked by groups, Boston's published, Chicago's published, looking at rates for women for pregnancy, miscarriage, stillbirth, preeclampsia, like complications. For people who have had the vaccine, their rates, fortunately, are the same as what we had as a population prior to COVID. So they do not have any increased risk of any of these things. The population that does have an increased risk is the unvaccinated population, because we know that COVID is associated with an increased risk of preeclampsia, preterm labor, stillbirth, and not to mention the fact that moms who are pregnant are sometimes getting very sick because their immune system is compromised. So not only is this is one of those, goes in the category of doing so much more harm than good, misinformation. I think, the ACOG, which is the regulatory body for OBGYN, has been very clear that they state that this is a good thing for their expecting moms to do. The American Society of Reproductive, the fertility specialists, they recommend it. In pediatrics, I don't have any concerns. I've had some. I've had rumors or heard people say that they heard of a friend who didn't get their period for a few months after they got the vaccine. That is not because, if that is true, and if that is happening, it is not because there's anything harmful happening. Another thing was this thing about the basis for this initial memo. They said something about how the protein fragment that is coded for by the mRNA vaccine is similar to a placental protein, so that's a basis by which this is a concern. There was, out of Chicago, they did a study where they inspected immunized women's placentas, and those were all normal. This is really trying to be addressed directly through science, and no one is finding anything except encouraging news that this is a good thing to do for women who want to have healthy babies. The last thing I'm going to say is, it is not true, but if it was true, wouldn't it stand to reason that if the protein was something that was going to generate friendly fire, there's that term again, friendly fire, and that the body would make antibody that would attack the placenta, why would natural COVID be so much more preferable? Again, why would you want to have that protein replicating unchecked in your body for a week or more if it was not? So to me, it goes down in the category of misinformation that has probably done a lot of harm, and makes me a little upset because of it, because women have had problems, and babies have suffered because of the fact that initially we didn't know.
Mm-hmm.
Initially we didn't know,
right?
But now we're knowing.
Mm-hmm.
And so I do feel like now is the time to talk to your OB or whoever you see for GYN care, and really have an honest conversation about getting the vaccine.
Yes. The last question that I have, and then I have seen just a few questions come in while we've been live.
Mm-hmm.
Should children who maybe have allergies or underlying health conditions, is it still recommended that they receive a COVID-19 vaccine?
For sure. Yeah. Interestingly, I will address this. I know that in the beginning when COVID first hit and we didn't know a lot about it, there was a lot of concern about how our asthmatics would handle it. And, especially our severe asthmatics. And, we had a lot of appropriately concerned families. I think what we've learned is that regular traditional pediatric asthma, especially, significant asthma controlled on steroids to reassure people, those kids seem to do well with it. They seem to do okay with it. So I think in retrospect, the asthma in the beginning was more like the chronic bronchitis and the adult asthma, especially, triggered and related to inflammation from smoking and those sorts of conditions. So in pediatric asthma, I'm not as worried. But having said that, I'm not as worried as I would based on someone who doesn't have asthma. Mm-hmm. But having said that, I would still encourage them to get the vaccine. Allergies or no allergies, asthma or no asthma, I think it's a good idea for everybody.
Great. Thank you.
Yeah.
So we have, I have to read it. Someone said, thank you, Dr. Palmer. So another person said, we love Dr. Palmer. So you've got some good, encouraging folks watching today. We have a youth watching, so hi to the youth who's watching.
Nice.
And one of two questions that I have at this point. The first one is, and we did talk about this before, but it might be worth reiterating again. Sure. If a person has had COVID, don't they have natural immunity? Why would they need the vaccine? Mm-hmm. And you had talked about that natural immunity can hold, but it can also waver, where that vaccine might act as a booster, essentially.
Exactly. And I know some people who are periodically giving blood because that is one place that you can get a free test to get antibody. So if you want to know, you can give blood and they'll test, because of course they're saving that. One of the treatments now is convalescent serum. So someone who's had COVID, that serum can be very life-saving for someone who's seriously ill in the hospital. So yeah, if you want to know, you could give blood. The one thing is you got to keep in mind, like for the Pfizer vaccine, that's about 5 weeks to become, you get the first vaccine, 3 weeks later, the second vaccine, and then it's 2 weeks later to be fully immunized and considered protected. So if we're looking to avoid quarantine, just keep that in mind when you're timing everything out. Because right now, anyway, I haven't heard any changes that the CDC is saying, you have to be 3 months or less from your original diagnosis, document diagnosis of COVID in order to be exempt from quarantine. Mm-hmm. So, some people have, that's one question, is how long do I wait?
Right.
And that's something, I think if someone received like the convalescent antibodies or the monoclonal antibodies in the hospital, they have to wait 90 days. Yep. Because it could blunt your response to the vaccine. For the other folks who were outpatient COVID, that's the question, is how long do you wait? And as a family member, I think she only waited like 5 weeks, because she was in medicine and was seeing what was happening and really wanted to get protected. But I do think, I think the sweet spot is probably around the 8-week mark, but public health may say differently. But if my patients ask me, I say, if you do it after 2 months, then you'd be fully protected within a week or so when your quarantine window would end. But I don't think 3 months is unreasonable either. The longer you wait, maybe the more mild your symptoms will be. So I guess it depends on where you prioritize things.
Yeah, in terms of vaccinating someone who had recently had COVID, as long as they're off isolation, we can give them a vaccine, but we do recommend they talk with their physician just to get that guidance, because sometimes people's cases were a little more severe, less severe.
Exactly.
So really, I would highly recommend, talk with your physician and kind of see what their recommendation would be.
And if there was any evidence of heart inflammation with that initial, like obviously some of these MIS-C kids, you're going to have perhaps a different approach to those kids and involve a specialist to help guide you too in that situation. So yeah, great idea. Talk to your provider.
Sure. And then the other question I have, we might need to clarify a little bit. So they had heard that Delta is mild, which we've said differently throughout the broadcast. So
unfortunately,
because they feel like they have heard that it is mild, they are wondering why the CDC wants to make everyone mask up again. But I like how you said it. Dr. Palmer has called it COVID plus, basically, which I think is a really, if you've got regular COVID, this is like a step up in terms of contagiousness and things like that.
And again, this is all a work in progress, so we're learning. So in the areas where they're having a huge spike in new cases, they're also seeing a larger number of people coming to the hospital again, and those people are younger. Now, is that because it is so much more contagious that, we don't know what the denominator is?
Right.
So I think people are hesitant to say it causes more severe disease because we don't know if it's just because so many more people are getting it right now. But what we do know is it's more, it replicates more, and so you shed it more likely, and you're more likely to pass it on. So I think the jury is still out. There's some guesses that it might be that it's also causing more severe disease because we are seeing, I'm not seeing, but they are reporting younger people who are in the hospital who are seriously ill. But I guess we don't know for sure if you have, like if the first wave, an area only had 2,000 people who were sick, and the second wave they have 20,000 people who are sick, you're obviously going to see more people coming into the hospital. So I'm not sure if that's too confusing, but so I think it's COVID plus in contagiousness.
Yep.
And because of that, my likelihood of giving it to someone else is going up, so it's going to be transmissible. And this is one more thing I'll say that I've shared with people is that even if COVID is for the vast majority of people a fairly benign condition, like part of the reason why COVID is we are so intimidated by it is because if our hospital gets overwhelmed, then what was a mild condition in the hospital becomes a potentially worsening condition in the outpatient setting because we don't have a bed. So like if a person comes to my emergency room right now and they have COVID and their SAT is like say 92% and we have a bed, we may say, hey, come in, rest, let's give you a little oxygen by nasal cannula, we give you maybe a little cocktail, and then you'll feel better and go home. But if we have 15 people who are already in the hospital with oxygen saturations of 87%, we can't offer that person within 92 or 93% of bed. And so then all of a sudden you have, more and more serious outcomes because of the fact that you're having to, care for people in different ways. So part of the reason why COVID is bad is because it's bad, and part of the reason why it's bad is because too many people get it at once and it overwhelms the healthcare system. And that's why when an area gets hit, all of a sudden you see physicians and nurse practitioners and nurses on Facebook talking about how stressed they are, and literally it's going to be years for people to get over what they're experiencing because they're in a situation where they can't necessarily take care of everybody the way they normally would, and it's a traumatizing situation. So it's not just the disease, it's our ability to respond to it if we get overwhelmed.
Right. So the more vaccinated people we have in a community,
yes,
the more relief you can give to the healthcare system. And it was recently in the news this week that Lewis County is one of the lowest in the state, one of the lowest counties in the state. So it's important to get the credible, accurate information out there in case there are people who are still on the fence,
sure,
needing some more education,
sure,
and that's okay.
Right. And I know that the whole FDA authorization versus FDA, because right now it's emergency use authorization,
correct,
we're still waiting for the process of FDA approval to go through. I know for some, they are waiting for that process to complete. I personally can't speak to what that timeline will be.
Right.
I don't know. But I will say that, like I mentioned earlier, I don't know if I've ever had better data on a vaccine than we have right now. There's the vaccine adverse event reporting system that picked up this issue, and we have, continually monitoring what's happening. People are being tracked from the original study. Those folks are still being tracked, so we're over a year of data now. And so I would say to folks, really consider, instead of waiting for that official word, really consider going ahead and doing it to protect yourself and to protect the people you love.
Thank you. That's all the questions that I have on Facebook.
Oh.
If you are watching this after the live stream, like later tonight, tomorrow, and you have questions, you're more than welcome to leave a comment. I will check in and see if there are any, or you're welcome to call us at Public Health. You can call your physician. I mean, there are people locally who can answer questions that you may have.
Mm-hmm.
Because this is a more child and youth focused COVID-19 broadcast, if you will, then I would like to promote, we do have a Pfizer clinic happening this Friday. Public Health is putting it on at the Lyons Falls Bible Fellowship Church. It is going to run from 2:30 to 5 o'clock. You can pre-register on our website if you go to www.lewiscounty.org. There's a little button that you can click there, you'll see the link. And you can register that way. We may also be taking drive-ups that day as well, as registration numbers have been fairly low, and it does look like we will have the amount of vaccine that we need to accommodate for the demand. If you are unable to come this Friday, you can also call us at 376-5453. We are starting to give those vaccines in-house. You just need to make an appointment, and we can get you set up that way. We're also not the only ones that give vaccines, so if you'd like to go to your pharmacy, you can also go to vaccinefinder.org, type in your zip code, enter it through, and it should show you all of the local venues that have a COVID-19 vaccine near you.
And for Pfizer, specifically for the pediatrics, you guys are having it, and also Kenny's is having it in town.
Oh, good. Perfect. So again, as of today, that's 12 and up. And I would also like to say, if you are one of those parents that maybe you're like, I cannot go through another quarantine this school year, if you are able to come to our Lyons Falls drive-through clinic this Friday, they would be considered fully vaccinated the Friday before school starts. They're 2 weeks after that second shot, you'd be considered fully vaccinated, and thus if they didn't have any symptoms and were exposed to someone at school that was positive, they wouldn't have to quarantine. So that may be a perk for some as well. I have to read them again. Great job, Dr. Palmer. Thanks, Doctor. Thanks, Dr. Palmer. You're the best. I would reiterate all of those sentiments. Thank you for taking the time to do this with us.
It's important. It's worth it.
It is. Do you have any last thoughts or remarks you'd like to give before we conclude?
No. Go Lewis County.
Yes, please. Wonderful. Okay, so again, if you need information about upcoming clinics, visit our website at lewiscounty.org. And if you have any further questions, you're more than welcome to call us or call your local physician. Thank you and have a good night.
Thank you.